Number 12. Open abdominal surgery. Open abdominal surgery, like bowel resection, involves significant cutting through abdominal muscles to remove diseased portions of the bowel. While necessary for conditions like bowel cancer or severe inflammatory bowel disease, the pain levels can vary from moderate to severe. Number 11. Liver resection. Liver resection is a surgical procedure that involves removing a portion of the liver, typically to treat liver cancer, benign tumors, or trauma. The pain associated with liver resection can vary depending on the extent of the surgery and individual pain tolerance. Number 10. Cardiac surgery. Coronary artery bypass grafting, or CABG, is a complex procedure performed to treat coronary artery disease. During surgery, the chest is opened to access the heart, which involves significant trauma to the chest wall. This procedure is vital for restoring blood flow to the heart muscle, yet recovery can be challenging due to the pain associated with the sternotomy and the healing process of the heart tissue. Number 9. Craniectomy. Craniectomy involves surgically removing a portion of the skull to relieve pressure on the brain, often due to trauma or swelling. This procedure is crucial for preventing further brain damage but is associated with significant pain during recovery. Number 8. Total joint replacement. Total joint replacement surgeries, such as hip or knee replacements, are common procedures to relieve pain and restore mobility in patients with severe joint damage. While advancements in surgical techniques have improved outcomes, these procedures can still be associated with significant initial pain due to the surgical incision and the trauma to surrounding tissues. Number 7. Amputation. Amputation is the surgical removal of a limb, often necessary due to severe injury, infection, or disease. This procedure involves cutting through muscles, bones, and nerves, which can result in immediate and phantom limb pain. Number 6. Proctectomy. Proctectomy is a surgical procedure that involves the removal of the colon and rectum. This procedure is necessary for patients with severe inflammatory bowel disease such as ulcerative colitis or familial adenomatous polyposis. The pain associated with proctectomy can be significant due to the extensive nature of the surgery and the impact on bowel function. Number 5. Thoracotomy. Thoracotomy is a surgical procedure that involves making an incision into the chest wall to access the thoracic organs, such as the lungs or esophagus. This procedure is necessary for treating conditions such as lung cancer, pneumothorax, or trauma. The pain associated with thoracotomy is significant due to chest wall trauma and manipulation of lung tissue during surgery. Number 4. Pancreatectomy. Pancreatectomy is the surgical removal of part or all of the pancreas, typically performed to treat pancreatic cancer or chronic pancreatitis. This procedure is highly invasive and complex, involving the delicate pancreatic tissue and adjacent organs. The pain associated with pancreatectomy is severe due to the role of the pancreas in digestion and insulin production. Number 3. Pelvic exenteration. Pelvic exenteration is an extensive surgical procedure used to treat advanced pelvic cancers. It involves the removal of all pelvic organs, including the bladder, reproductive organs, and part of the colon. The pain associated with pelvic exenteration is profound due to the extensive tissue removal and potential nerve damage. Number 2. Spinal fusion. Spinal fusion surgery involves permanently joining 2 or more vertebrae to stabilize the spine and reduce pain caused by spinal instability or deformity. While beneficial for improving spinal alignment and relieving symptoms, spinal fusion is a complex procedure associated with significant pain during recovery. Number 1. Complex spinal reconstruction. Complex spinal reconstruction surgeries are performed to correct severe spinal deformities, often requiring extensive procedures and multiple interventions. The pain associated with these surgeries is exceptionally high due to the intricate nature of realigning the spine, manipulating delicate nerve structures, and the prolonged recovery period.